For over 50 years, BOULDERCENTRE for Orthopedics and Spine has been serving patients in Boulder, Broomfield, and the entire Front Range. As the region's most preferred orthopedic practice, they offer the latest in joint replacement and revision techniques in their state-of-the-art facilities. Their doctors are highly trained specialists focused on and dedicated to delivering orthopedic excellence. I recently spoke with Dr. Brian Blackwood. As an orthopedic surgeon, you specialize in hip and knee replacements using advanced technology. So walk our viewers through a little bit about what you offer and the procedures that are available.
Yeah, so my practice is focused on advanced technology and minimally invasive techniques for replacing hips and knees. So we're able to do partial knee replacements, full knee replacements, and total hip replacements, as well as revision procedures as well. So if you need a second time hip or knee replacement. We'd like to increase and include technology in this to make us more precise and to give patients the best outcome that we can. And we use minimally invasive techniques so they can have quicker recoveries and less pain throughout the process of recovering from these surgeries.
Yeah, and when you mention minimally invasive, how kind of has the technology become much more modernized to be able to offer this to your patients to get that recovery?
Yes, we've been working with minimally invasive surgical techniques since my fellowship back in 2011. And we've been working in refining that. So it's less damaging to the soft tissues. We're not just having to cut what we have to cut, not anything extra. And then we're doing a better job with pain control after the surgery as well. So we're having patients taking less narcotics, less time off of work, less time on assisted devices, less canes, walkers, those kind of things, and getting patients back to recover faster with this less invasive surgical techniques, and then combining that with the advanced technology.
Okay, and at BOULDERCENTRE, when it comes to part of the recovery, the healing, Fast Path, this is something that you guys developed. Talk to us about those details.
Yeah, so in the process of going through and refining this process, we decided to put a label on it, and so we call that Fast Path. So that's our way of going through and doing this minimally invasive surgery and this sort of enhanced accelerated recovery with this Fast Path technique. It's a little unfortunate we had to name it. It's just the way we always do it. And so we'd like patients to know what that looks like. There are some other techniques that have come onto the market in the last month or so where the surgeon unfortunately just goes there, watches the surgery for one time, and then actually pays that surgeon $20,000 to $30,000 a year to be able to be branded as a Jiffy surgeon. And so we wanted patients to know that we are on the front edge of this as well and trying to enhance recoveries, and that you can get that from people who've been doing it for years and years and thousands of surgeries.
Yeah, that's really important to know. Thank you for providing those details. Really, why was Fast Path developed, and how do you see this just positively impacting your patients?
So we're always trying to get better. We do a good job. We've gone from patients being in the hospital for 2 weeks 20 or 30 years ago to 5 days in the hospital 10 years ago, to overnight 4 or 5 years ago, and now we're having patients go home the same day. And so to sort of minimize that recovery time and make it easier for patients to get through this process really allows them to make that decision a little easier, so they can, going through a joint replacement is a big decision. It can be a lot of pain and recovery and work afterwards. And so we want to make that easier for them to get through and make it a not quite pleasant experience, but an easier one to have to deal with.
Okay, there is a movement that's called March to a Million. Talk to us about these details and how you're involved.
Yeah, and that goes right in well with the Fast Path. So March to a Million was started by Dr. Andrew Wickline out in New York State. He, and as well as I and others in our practice, have had experience with patients who've had opioid addiction problems and even overdoses and deaths. And so we as surgeons have played a role in that by doing too much, prescribing too many medications, and I was guilty of that in my early practice as well. And so now we're working to figure out ways to decrease pain and have patients do this with less than 10 oxycodone pills, or even many patients are taking no narcotic pills after the surgery. And so that allows them to get through that recovery process. There's some blocks that we can use that last 4 or 5 days. There's new medications on the market that help to block the pain receptors peripherally. And so we're doing a lot better. We're actually in the top 10 nationwide for this group of surgeons for having the most patients go through with minimal narcotics. And so I think that shows that we're doing a good job of getting our patients quick recoveries and also less pain.
Okay, and you've been named a Castle Connolly Top Doc. Talk to us about what that kind of award means and why it benefits your patients.
So yeah, Castle Connolly awards the top 7% of doctors in the country this recognition. So I think it's a stamp of quality that patients can trust. They can go online and read Google reviews and talk to other patients, but to have sort of this independent program that the company that only evaluates the doctors and looks at those rankings. Those are also used for the 5280 top docs around the metro as well, which I've been fortunate enough to be named that as well. So just it helps to give you a check and feel comfortable with who's doing your care and who your surgeon is.
Absolutely. Great to talk with you, Doctor. Thank you.
Oh, thanks for having me on.
To learn more about Dr. Blackwood and his specialties, visit bouldercentre.com. That's also where you can find details about the orthopedic care services provided at either one of their Front Range locations in Boulder or Broomfield. To schedule an appointment, call 303-449-2730. And for more on the FastPath recovery protocol, visit them online at bouldercentre.com/fastpath. Boulder Center paid for this segment. We'll be right back.